So I really want to do a bit of a sketch, my view as a sociologist, some of the social historical reasons why people have become exercised about these things. So it's going to be very, very whistle-stop, and I'm going to raise a few questions as we go. Go back to the 1950s, 1960s, you see the beginnings of a critique of putting people in institutions. You get John Bowlby highlighting the devastating effects on 2- and 3-year-old children when they're separated from their mothers, when they're in pediatric care inpatients. You get people like Irving Goffman and Peter Townsend in this country exposing what happens to the human self when they're incarcerated as old people in what Townsend called the last refuge, the old person's home, or as mental patients. And I think that was all very much part of the ethos of the time, of the counterculture's anti-institutionalization. Institutions are bad, individual freedom is good. We have to go back to there to see some of the origins, and you can see how this unease with dying in hospital comes out of that kind of sentiment in the 1960s. So that's anti-institutions from hospital to home, question mark. Now anti-professions from doctor's orders to patient choice. And we go now back to the 1960s, 1970s with the sociology of professions who exposed medical paternalism, medical power. I'm thinking of sociologists like Elliot Friedson, the French philosopher Michel Foucault, and of course Ivan Illich, who Ros has already alluded to by talking about the limits to medicine. And out of that climate of discussion and research came the idea that there certainly has to be need for open communication between doctors, nurses, and patients. Decisions should not be made about dying cancer patients without their knowledge they're even dying, let alone inputting into what's going to happen to them. So we had this idea of the patient as an active agent, and we have a skepticism about medical paternalism. And that was coming to a large extent from a kind of rather left-of-centre approach in the 1970s. And then, of course, it gets co-opted by Margaret Thatcher in the 1980s in her attack on one profession after another. And you get, coming out of that, this neoliberal notion of choice in healthcare. And a skepticism about the profession, and a raising of the status of the patient as consumer. So we get the notion of patient choice. Now, whatever you think about that, and there may be some good and some not so good things about that, the question I want to raise is, okay, we've got a kind of philosophy of choice of the individual autonomous agent. Should we also I think we need to complement that in our culture and in American culture with perhaps a complementary philosophy of dependency. In some countries like Japan, there's a much more cultural valuing of dependency. And we may have to look to other countries to see what that might look like. Interestingly, I think intuitively British people do have a certain valuing of being looked after. One reason we love the NHS is its unconditional offer of care, which actually doesn't quite fit this culture of patient choice. I remember at least 2 occasions when I've been in an ambulance in this kind of this womb of being totally looked after. Things were going very pear-shaped, and here were people who knew what they were doing, and there was no patient choice, and it was wonderful. It was what the Japanese called amai, an adult experience of the baby's experience, an adult re-experience of the baby's experience being totally looked after. The Japanese have a word for it, we don't, but we understand it in our love of the NHS, and we need to have a concept to talk about it and to work out how that works out in end-of-life care. So, for example, if the patient is not an autonomous agent, as somebody with dementia or a stroke, all the philosophy of choice can do is say, well, you've got to do an advanced directive earlier on, which we'll talk about this afternoon. And I don't think that's enough. We need to have more than that, because we need to have some other way as well of thinking about how to care for somebody who can't articulate choices. The death awareness movement, reform from without or from within, hospice, palliative care, the notion of total pain and so forth. Was this a consumer rebellion, a patient rebellion, a critique from without? Or was it a critique, a reform from within by concerned, humanistic and religious doctors? It was overwhelmingly the latter. And that's fantastic, but it led also to what, in a Foucauldian perspective, you would call an expanded medical gaze. The doctor now not only looks at my organs, the doctor wants to know about my emotions, my spiritual state, my very soul. This is an expansion of medical power. It's certainly an expansion of the medical gaze, however concerned and humanistic it is. And there's a real issue here. And then I look at a whole plethora of non-medical, paramedical occupations which are arising and expanding, arts therapists, doulas, volunteers even, and many of them pride themselves on trying to constrain or even demedicalize dying, but in the process, they just expand the professionalization of dying. So I now can't die without help from an art therapist, a psychotherapist, a bevy of volunteers, God knows who. And it seriously worries me. And they don't get it. They really don't get it, many of them. Okay, thirdly, gender, from masculine to feminism. From masculine to feminine. Overwhelmingly, the reform of death and dying has come from women. It's not just Elizabeth Kubler-Ross and Cicely Saunders. Overwhelmingly, it has been women. And fantastic, we've got some men involved in this commission. The commission is slightly male-heavy, which is unusual in this area. But this whole notion of total pain and total care and a holistic approach and not just the organ, I do wonder, is that a female revolution against mechanistic medicine? There's been very, very little research into what patients themselves, how they themselves see their bodies. And the willingness to see myself when ill in terms of a set of organs, is that something which more male patients and female patients actually embrace? Have we got actually to some extent the imposition of a female, more holistic view of the person on many male patients? It's only a question, it's a provocative question, but it's a question because it has not been researched. It's just been assumed that holistic care is a good thing and just looking at organs is a bad thing. But what do patients themselves think? A student of ours at Bath recently did her PhD on old people living at home and how they saw themselves. And one of the people she talked to was a bloke in his mid-80s, and he did see himself as a bundle of organs. Right. Lastly, compassionate communities, from medicine to community, and Raj is going to talk more about this. And this has been, as most of you will probably know, the up-and-coming thing over the last 10, 15 years or so, certainly in this kind of meeting on the ground, maybe slower to get going. And this is very much the idea that medical and professional expertise needs to be placed in the context of existing communities. Yeah, I think it's said in Africa it takes a village to raise a child, this approach really is effectively saying it takes a village to actually help somebody die, 20 people around the Sudanese deathbed. And the challenge in our sort of society is how to actually enable our communities and our streets and our where we live to become more like that. We do it at the beginning of life. Yes, the actual birth may be quite medicalized, but we understand that what then follows in the days and weeks afterwards, it's a family affair, it's a community affair, everybody's involved. And sure, the midwife and the health visitor has a technical place within that, but they don't dominate it. And the challenge is how to make the last few days and weeks like the first few days and weeks. And that's what Compassionate Community is trying to do. So those seem to me to be 5 features which have helped drive the critique of the medicalization of death. And I've described them in a slightly provocative way, which I hope has raised a few questions.